Greetings. Hi, I'm Dr. Walter Jacobson, a board certified psychiatrist. The question is, have you been to a mind mechanic lately? Right, what do I mean by a mind mechanic? Well, a therapist of some sort. Somebody who's going to, change your oil, right? Change the oil filter, change the oil, check the air filter, check the air in the tires, tune up, spark plugs, etc. We need this. Human beings need this. Now, in general, people go to psychologists and psychiatrists when they've hit a wall, when they've kind of exhausted all resources, where they feel now it's too much, they can't handle it. Now they're going to get some help. It's usually when they've hit a crisis. They're in a crisis mode of a deep depression. They may be bipolar. They may have anger issues, depression, anxiety, panic attacks, PTSD. There's a million things people have, and they don't address them until things get really bad. So they try to kind of handle it on their own and deal with it as best they can, and then they go to a therapist. But it seems to me that many people who need therapy, many people who would benefit from therapy, where therapy and getting a second opinion and gaining another perspective on how they see themselves in relationship to others and the world, they will have more effective and happier lives and better relationships and healthier emotions. People really do need to have a tune-up. So I'm not saying that everybody listening should immediately call up a therapist and start going weekly. But what I am saying is maybe it's a good idea if each and every one of us once a year goes to a therapist and just talks about stuff. You kick around what's going on in your life. Are you happy? Are you sad? Are you frustrated? Are you angry? Are you feeling good about where you're going in life? Are you full of regret and anger? Could you use a little forgiveness training? Could you use a little cognitive therapy to learn how to not catastrophize and over things that aren't going to happen, but you fear might happen? Mental health really involves paying attention, looking at your thoughts, being self-reflective, being self-conscious, not in the sense of being nervous and shy, being self-aware, self-conscious, being aware of your triggers, the things that get you upset, that make you anxious or angry or depressed, so that you can learn how to neutralize them and be happy. There's a lot we can do with our mind, There's a lot we can do to use our mind to be happy. To get high with our mind, so to speak. Well, how do you do that? Well, you got to eliminate the negative. You got to learn how to eliminate anxiety and fear thoughts, and how to neutralize them, how to coexist with the stress in your life. You got to learn how to neutralize depressive thoughts, angry thoughts, anxious thoughts. When you can get rid of all that crap and be living in the present, and so you're not you're being full of shame and guilt and anger and depression over the past, and you're not fearing the future and being depressed about and hopeless about what might happen if you're in the now, in the present moment, with your mind not focused on the past or the future, but smelling the roses here and now, right? Being alert and aware, using your senses to enjoy and be grateful. You can be happy. You can kind of be high with your mind without drugs of any kind. Okay, so what's the point? The point is mindfulness is important. And you can, if you once a year, let's say, you go to a therapist to try to help you be mindful, help you be focused, help you to be aware, help you to look at the stuff that's bothering you and how to change it or deal with it once a year. Okay? It's a healthy thing to do. It's a positive thing to do. You go to a doctor once a year to check your blood pressure and your cholesterol, your heart rate, you make sure you're not getting diabetes. So maybe we should have an annual mental health checkup, and I believe it would make your lives better individually, and ultimately, yes, it'll make the world a better and safer and happier place as well. So think about that. Think about getting a tune-up on a regular basis, and learning how to get high with your mind without drugs. And let me just say something regarding drugs and medications. I'm not talking about the recreational drugs that people use. I'm talking to get high. I'm talking about the medications that people use to get high and away, because they're popping tranquilizers, and they're popping sleeping pills, and even the antidepressants and other medicines. Look, if you don't need a drug, a medication, you're better off. If you do feel you need a medication, the least amount and the fewest number is the best way to go. But there are so many people out there that are looking for the quick fix. They're looking for a psychiatric medication that will resolve all the problems, so they don't have to think, so they don't have to actually do anything, process anything, deal with anything, change anything. To some degree, they just want to be numb and get through life, but that's not the best way to go. So I encourage you to first, if you're having troubles, if you're having depression, anxiety, anger, see if therapy can help you to use your mind to neutralize the negative and coexist with stress and anxiety, and deal with life without medications. If you need medicines, find a doctor who's responsible, who's going to find the least number and the least dosage that'll help you to cope and manage. Because believe me, these things can help you, and some people seem to need them, but many people use them too long and too much as a crutch, and you really should learn how to stand on your own two mental feet, so to speak. Anyway, that's all for now. See you next time.